Hey guys, thanks for tuning in. Nick with Jumping the String. So I'm just going to quickly go over my backcountry medical kit. I use a Magpul Daka pouch. These things are great for lots of purposes. It's not about the pouch, however, I would recommend this pouch for this particular purpose. It has a window so you can see what's inside. Fairly waterproof, not 100%, but if you take a dip in a lake or a creek or whatever, it's gonna protect all of your stuff. So nice zipper on it, couple carabiner holes. Highly recommend this pouch. So moving on, first want to apologize. This is my second take. I already pulled everything out, so I'm not gonna do that again. I'm just gonna go one item at a time and try to get through this quickly. Quick background about myself. Been in fire, EMS, 10 plus years, search and rescue, 7 or 8 years. So I just want to pass on a little bit of my experiences and knowledge with you guys so that you can be as best prepared as possible. So first things first is a good quality tourniquet. So you need something to stop major bleeding, okay? If you're 3-4 hours away from a hospital, 10-12 miles back, you're going to pass away if you don't have a way to stop major bleeding. And you're not going to improvise a tourniquet. I'm telling you that. You're not going to do it well, at least. If you've ever had to improvise a tourniquet, it doesn't work that great. And you shouldn't plan to improvise, all right? So a good quality tourniquet. This is a cat tourniquet. Moving on with that, this is a high fin vent chest seal. These usually come in a 2-pack. You only need one for this purpose, and I'll explain why in a little bit. Highly recommend these types. If you have a penetrating chest trauma, you need to keep air out, outside air out, and keep your air in your lungs and your diaphragm in. This will help you do that. If you have a penetrating chest wound and you let air in, and the air that you're breathing in your lungs is not staying in that cavity, you're going to create what's called a tension pneumothorax. Your heart is going to just get crushed and you will pass away that way. So you need some way to stop a penetrating chest wound from sucking in air, also known as a sucking chest wound. You should have some type of airway. This is a Combat Medical Systems nasopharyngeal airway, 28 French. It's pre-lubricated. I love these things. I use these out on the road as well, just regular patients, regular traumas. Highly recommend these. Comes in one size, 28 French. That'll fit 90% of the population out there. Slightly modified. If you've seen one of these before, highly recommend these. These things are awesome. Essentially, if you have an unconscious person, they need to have a patent or open airway. Now you could sit there for 10, 12, 24 hours and hold their head up or in an open position to keep their airway open, but that's not logical, okay? You can put this in someone, they'll keep their airway open, and then you can do other things. Go get help, work on other injuries, that sort of thing. You can also get an oropharyngeal airway. I just prefer the nasopharyngeal airway, so get some training on that. Next up is some type of tape. This is just a duct tape. Next time you get a credit card offer in the mail, take out that crap and put several yards of duct tape on it and carry it that way. Medical tape kind of sucks with blood and goo and all that nasty stuff that we have in us. Duct tape's going to do much better and offer you way more options out in the backcountry. This is a chest decompression needle. Really need specialized training for this. However, if you just want to carry one, if you hang out with paramedics, doctors, military medics, wouldn't be a bad idea for them to use. This would kind of be reserved for friends and family only. So an option if you want to look into it. That's a needle decompression. You should also have some type of occlusive dressing. This is just gauze that has petroleum on it, petroleum jelly, and it creates kind of a gooey, sticky seal. Much like the chest seal, this is just a lot cheaper. So if you have a penetrating chest wound that is an entry and an exit wound, you're gonna need to cover both sides, put your chest seal on the front, and then you can just fully enclose that exit wound with one of these. You can also use Tegaderm. I highly recommend this. That will work for your sucking chest wounds as well as burns, scrapes, cuts, other things to cover it up if you don't want to get it wet or moist or nasty. Tegaderm, awesome product. Quick Clot Combat Gauze or any other hemostatic agent. Celox, Hemcon, there's a lot of them out there. All of them are pretty good. Basically, if you put this into somebody's wound, pack it in, it will create a chemical reaction that will help clot whatever is bleeding, whether it's an artery or a vein. Highly recommend these. Regular gauze will work as well. This stuff just works better. A triangle bandage. Any triangle bandage will do. They're only like $1. You can split stuff with this. You can make slings if someone's got a bad shoulder. You can also secure bandages or any of your medical interventions you've done with these, and you get 2 safety pins. Another tip for your airway, it's kind of gruesome, but if you don't have anything else, you can take this safety pin, pull the person's tongue, and safety pin their tongue to their lip. It's going to be kind of bloody, kind of look weird, but it will keep them alive. Almost forgot, most important thing. Your PPE needs some type of nitrile glove, preferably more than 1 pair. I also like to carry, also like to carry a trauma shear. I carry pink so nobody steals it. You don't necessarily have to have this. It is a little extra weight. However, if you've ever tried to cut clothes off somebody with a knife, it's kind of nerve-wracking. This will make it safe, blunt tip, and it'll cut through a lot of stuff. You can cut through leather boots with this, a belt, backpack straps. So you just get a lot more bang for your buck if you have a dedicated pair of trauma shears. And those are cheap too, a couple bucks, you can get yourself a pair. Some type of good metal tweezer. Enough said. A twin tip Sharpie, fat end for whatever you need a fat end for, and a fine tip for whatever you need a fine tip for. That's important because you mark your time that you put your tourniquet on. You can also write on someone's arm or their forehead, whatever they have going on with them if you don't have paper. Speaking of paper, I'd recommend you carry some type of paper. These are from a Write in the Rain notepad, a medical notepad. You don't need these in particular. Any post-it note will do. However, this just keeps you on track, reminds you of what information you need to get. Some type of syringe. This is a 10 milliliter syringe. This is good for flushing wounds, flushing your eye. If you get any type of cut, scrape, burn, or anything, you're gonna wanna flush it with your filtered water, especially if you get something in your eye and you're way back. You could do some damage if you don't get that flushed. This just allows you to get some back pressure and actually move material around much better than just pouring water into your eye from a water bottle. Then moving on to some of the more first aid item stuff. You don't really need a whole lot. I just have a smorgasbord of over-the-counter medicines. There's a scalpel in here for if you need a clean, sterile blade for something. Sting relief pads, a few band-aids, super glue in case you need super glue for a wound, some moleskin, aspirin, some electrolyte tablets, lots of different things. A couple things I recommend is to have an EpiPen with you and Benadryl. That will get you through most allergic reactions. And then obviously any personal medical stuff you may need. I also like to carry one nice big square Band-Aid and then a betadine thing. I also have some alcohol swabs in here, but this is also good for if you have to prep a site, clean an area. So that's pretty much it. If you guys have any questions at all, please let me know. I'll try to answer them as best I can. Again, the big things here is make sure you have a tourniquet, a chest seal, some type of airway, and some type of gauze. That will at least get you through, you know, a traumatic injury as best you can take care of. So, again, Nick with Jumping the String. Thanks for tuning in, guys.